In this lesson, we'll continue our discussion of the heart by taking a look at the internal structures of the heart. So we know from our previous lessons that there are four chambers of the heart. Just to review, the two upper chambers are the atria, and then the two lower chambers are the ventricles. Well, these chambers are actually separated also right and left, right? So the right atrium is separated from the left atrium. The right ventricle is separated by the by the left ventricle. So there's these walls known as septa, right? It's just a great word for a wall. The first septa we're going to look at is known as the interatrial septum. Inter means between, atrial means the atria, and then septum means wall, right? So this is a wall that separates the atria. Let's go to a picture. So this time we're looking at the heart with the external wall cut away. This is a frontal section. So you can see this chamber here is the right atrium. This is the left atrium. So what we see is this partition, this wall going up right here, and it would extend into the atria. We're just seeing the edge of it. This is the interatrial septum. Notice the interatrial septum is a thin wall. It's kind of just some fibrous connective tissue here. So that's going to be what it's made up of, is some fibrous connective tissue, opposed to the interventricular septum. Before I go back to the notes, let's take a look over here. This chamber here is the right ventricle. This is the left ventricle. So these two chambers are separated. But watch this, guys. This is a thicker wall right over here. This is known as the interventricular septum. Again, inter meaning between, ventricles is ventricular, and again, septum is a wall. But notice this wall is much thicker than this wall over here. That's because this is made up of a thick layer of cardiac tissue. This is made up of muscle tissue, right? So its anatomy is a little bit different. That's going to become important when we get to some other lessons down the road. So let's go back to here just to define these. So the interatrial septum, right, you need to know that it separates the atria. If you just want to add here, I didn't put it, but it's just made up of a thin fibrous connective tissue. Right? It's a thin wall. It's not a thick wall. It's made up of fibrous connective tissue. And then the interventricular septum is a much thicker wall that separates the ventricles. And if you just want to add, I didn't put it there, it's made up of muscle tissue, right? So it's going to be thicker and it's made up of muscle tissue. Okay, so also within the heart, when we look at the heart, we're going to see valves. We're going to divide the valves into two categories. The first category are the atrioventricular valves. You can see here we can call them AV valves. And then the second category is down over here. These are the semi-lunar valves. So let's go. We're going to go over these in more detail down the road in a couple minutes, but just to do an overview. So the AV valves, there are two of them. We have a tricuspid valve and a mitris valve. These valves are actually made up of folds of fibrous tissue that extend into the openings between the atria and the ventricles. So let's show you real quickly where the tricuspid and the mitral valves are. If we go back to this picture for a moment, let's do the right side first. This is the right atrium. This is the right ventricle. There's an opening between the atria and the ventricle, and if you notice, extending through that opening is a valve. This one here happens to have three cusps. 1, 2, 3. Hence the name tricuspid. And this valve allows the blood, I love this picture, it shows the blood going down from the right atrium into the right ventricle. So that's the tricuspid valve. We're going to see that stays on the right hand side of the heart. And then over here, 1, 2. This valve has two leaflets, hence the name bicuspid valve or mitral valve. You could definitely call it the bicuspid valve. You can call it the left AV valve, but most people in clinical medicine call it the mitral valve. So this valve allows the blood to flow from the left atrium, and again, here's the arrow showing the blood direction is flowing down to the left ventricle. Okay, so it permits the blood flow, like I said, between the atria and the ventricles. What's really important is this: it permits the flow in one direction, right? Specifically, it's allowing the AV valves are allowing the blood to flow from the atria above to the ventricles below. So here's my first dot here. One valve allows the blood to flow from the right atrium to the right ventricle. If you want to just put in parentheses here, that's the tricuspid valve. And then the other valve is going to be allowing blood to flow from the left atrium to the left ventricle. If you just want to put in parentheses over here, the mitral valve. And both the tricuspid and mitral, again, are atrioventricular valves. And it just means that they're between the atria and the ventricles, right? It's telling you the location. The other category of valves is known as the semilunar valves. There's two of them also. One is known as the pulmonary valve, and then the other one is the aortic valve. And we're going to see that these prevent backflow of blood into the ventricles. If you just want to add here, from the great vessels, and I'll show you what I mean by that. All right, so it prevents backflow of blood into the ventricles from the great vessels, just to kind of give us an idea, and then I'll show you what it looks like. So if we look over here, once we had the blood in the right ventricle, right, it came from the right atrium, it went through the tricuspid valve, now it's in the right ventricle. When the ventricle contracts, it's going to push the blood up, and we want the blood to go into this big blood vessel here known as the pulmonary trunk. The only way that the blood can go into the pulmonary trunk right here is if it goes through this valve right at the beginning of the pulmonary trunk. That valve has to open, the blood will go in. Now when the ventricle relaxes so that it can fill all over again, the blood in this artery here, the pulmonary trunk, is going to want to backflow this way. That would be bad. We can't have that. So that's when this valve closes and prevents the blood that's in here from backflowing into the ventricle. Okay, so we have one pulmonary valve here. That's a semilunar valve, and it's a little bit hard to see. There's one called the aortic valve. This is the left ventricle. So when the left ventricle contracts, it's going to push the blood upwards into this big blood vessel here called the aorta. You could just see a little bit above my cursor there, that little white line. That's a little bit of the aortic valve, right? We would have to cut away some more structures to see it completely. So we're just seeing a little bit of it. But both of these valves are preventing backflow, right? The blood in the aorta, when the ventricles are relaxing, wants to go backwards into this chamber, right? We can't have that. Um, and then again, when the right ventricle contracts, the blood wants to flow backwards. So in normal anatomy, those valves close. You will have patients, right? There are people that have incompetent valves and they leak the blood backwards, right? And sometimes it's very common. People have to get a valve replacement, especially that aortic valve. Okay, so let's go back. So this is the slide again, just kind of overviewing the valves. So let's take a look at each one of the chambers now of the heart. We'll start with the right side. Again, we could start anywhere, but by convention and it's just easier to understand, we'll take a look at the right side of the heart first, and we'll look at the right atrium. It is imperative that you know there are three blood vessels that drain blood into the right atrium. What they're bringing is deoxygenated blood from different regions of the body and dumping it into the right atrium. So here's the right atrium. So take a look at this. I'll go back over the notes in a minute. This big blood vessel here is a vein that's going to bring blood and dump it into the right atrium. This is known as the superior vena cava. It's draining deoxygenated blood from the head, the neck, the upper limbs, organs of the chest. All of those structures are giving rise to blood, deoxygenated blood, that ultimately goes into the superior vena cava and now dumps into the right side of the heart. The second blood vessel, look at the size of this thing. This big, huge blood vessel here is the inferior vena cava, and this is pretty much taking in deoxygenated blood from everywhere else: your torso, your trunk, your lower limbs, right? The organs inside your trunk, inside your abdomen, that type of thing. All of that blood is going up towards the right atrium, and you can see it open up right here. I love this picture. They're showing the arrows of the direction of the blood going into the right atrium, right? So here's the superior vena cava dumping its blood down. Here's the inferior vena cava dumping its blood up into the atrium. The third structure we're going to look at in the next lesson is known as the coronary sinus. That's a major vein that drains deoxygenated blood from the heart muscle itself. This little dot right above my cursor there is the orifice or the opening of the coronary sinus. So here, venous blood from the veins of the heart that are, taking out deoxygenated blood from the heart muscle itself is going to go into that opening there and dump into the right atrium, and that is known as the coronary sinus. Okay, so I need you to know all three blood vessels and where they're returning blood from. Superior vena cava, again, is receiving deoxygenated blood from the head, the neck, the upper limbs, the chest. Inferior vena cava is pretty much everywhere else. It's carrying the blood from that's deoxygenated from the trunk, the viscera, the lower limbs. And then the coronary sinus is the cardiac vein that's returning blood to the right atrium. We're going to see a lot of veins dump into that coronary sinus, and then the coronary sinus ultimately dumps into the right atrium. Okay, so again, just to show you where they are, superior vena cava, big blood vessel, even bigger, inferior vena cava, and then the opening to the coronary sinus. Okay, a couple other structures in the right atrium. So during fetal life, if you think about it, we're not breathing. We don't really need to send a whole lot of blood to the lungs to become oxygenated. So we can actually bypass some of the blood from going to the lungs by taking the blood in the right atrium and then sending it directly into the left atrium. Right? Normally they would go to the lungs first and then to the left atrium. But again, we're not breathing. We don't need to do that. So before birth, there's actually a hole in the heart known as the foramen ovale. And foramen means hole, ovale means oval, right? So it was an oval-shaped hole, and it connects the two atria, again, only in the fetal heart normally. Now, let me show it to you, and then I'll tell you what happens. So right here, there's a hole in fetal life right here, and the blood would go directly from this chamber here, the right atrium, directly into the left atrium without going to the lungs. When we take our first breath, this hole actually seals up, so blood no longer can shunt from right to left, and now the blood will go down this way to the right ventricle, and then through these blood vessels to the lung, and then come back to the left atrium. So that changes the hole when we take a breath in. It seals up, and now there's a slight depression there right here that has an oval shape. So we call that the fossa ovalis, right? That's what the hole becomes. Fossa means a shallow depression. So if you were to kind of palpate that, there would be a shallow depression there. Okay, yeah, so we don't need the lungs, right? Really, where the baby's gas exchange takes place is in the placenta, right, and, of the mother. So we really don't need the lungs until we start breathing. The last structure in the right atrium are the pectinate muscles. These are some muscular ridges. They're in the anterior wall of the right atrium, and then also the in the auricle. You can see here these big muscular ridges. They're called the pectinate muscles, and they're able to contract a little bit and squeeze some of the blood down into the ventricle. Okay, so from the right atrium, the blood is going to flow from here into the right ventricle. It has to pass through a valve. We've mentioned it already. Know it as the tricuspid valve, but you could also call it the right atrioventricular valve. When we look at it, it has three cusps, and the job of that valve is to prevent backflow of blood from the ventricle into the atria. I'm going to go to this picture for a minute. If you take a look at these cusps, they're kind of floppy. They're not really that strong. What would happen is if the right ventricle contracted, it would push the blood up. We want the blood to go this way into the blood vessel. The valve could theoretically flip back this way into the right atrium because these are not very, like I said, they're kind of floppy valves, they're kind of floppy cusps. So here's what's happened, what's developed. Attached to the bottom of the valve are these strings right here. These strings will anchor themselves to a muscle down over here. When the heart ventricle is contracting, this little muscle known as the papillary muscle is also going to contract, which tightens these strings, and it makes sure that the valve stays facing the ventricle, right? It would be devastating if the valve would flip backwards up into the atria, right? We can't have that. So these strings right here are known as the chordae tendineae, chordae tendineae, and then they anchor themselves on the papillary muscle. If you notice, the papillary muscle kind of has a mound shape to it. Papillary or papilla means mound-like, right? So they have a mound-like shape, hence the name. Right? So again, these structures are important to keeping the valve facing down into the ventricle so that it ensures blood flow only goes this way in the direction of that arrow, right? We should not have blood going the opposite way, right? That would not be good. So the tricuspid valve, right? Its free edges of the valve attached to the chordae tendineae. Those are those little heartstrings, right? Have you ever heard the term heartstrings? That's what they're talking about. And then it anchors itself onto the papillary muscle, which is going to contract a little bit and tighten up the heartstrings or the chordae tendineae to keep the valve facing down. Okay. One other thing you see in the right ventricle, you're also going to see it in the left ventricle. There's a lot of muscular ridges in the ventricle. We call these ridges the trabeculae carne. Let me go backwards, sorry. So if you look in here, all of these muscular ridges, all of this here is the trabeculae carne. That's the normal appearance. And then in addition, kind of blended into the trabeculae carne, there's a band of conducting tissue. It's almost like nervous tissue. I'm going to talk about this in a separate lesson, known as the moderator band. This band will bring the electrical impulse of the heart over to the pectinate muscles so they contract a little bit before the ventricles contract to tighten up the chordae tendineae and keep the valve facing down. Right, so we're going to only see this moderator band on the right side. We don't have the moderator band on the left, but we do have the trabeculae carne. Right, so all of these ridges are the trabeculae carne. Before I go back to the notes, let me just finish up one other thing. So the top part of the right ventricle over here, if you notice, becomes kind of triangular right here, kind of triangular, so that it kind of moves the blood into this big blood vessel over here. This area of the right ventricle, the top portion of the right ventricle where it becomes kind of triangular, is known as the conus arteriosus, right? Conus means kind of cone shape or triangular in shape. So just know that it's the region of the right ventricle. All right, near the top there. So the conus arteriosus is at the superior end of the right ventricle. It's going to lead, lead to the pulmonary trunk, right? It's kind of directing the blood towards the pulmonary trunk. And then right after the conus arteriosus, here, the blood will enter a valve. It'll actually go through a valve that's going to open and allow the blood to push from the conus arteriosus into the pulmonary trunk. This valve that has to open is known as the pulmonary valve, right? It's one of the semilunar valves we looked at a couple minutes ago. Now, the big blood vessel on the other side of the pulmonary valve is known as the pulmonary trunk. And this is the beginning of the pulmonary circuit. It's going to move the blood towards the lungs. So just one other lesson. Pulmonary trunk, whenever you hear the word trunk, it means the blood vessel is going to divide. It's going to split. And if you look at this pulmonary trunk right here, guys, this big blood vessel, that's the pulmonary trunk. Notice it splits into this left pulmonary artery, this is going to go to the left lung, and then if you follow this way, and then we see it over here, this is the right pulmonary arteries. They're going to go to the right lung. So trunk means that the blood vessels are going to split. And again, arteries are carrying the blood away from the heart. So now we're taking the deoxygenated blood away from the heart and bringing it to the lungs for oxygenation. Okay. Um, so that we got the trabeculae carne, we got the muscular ridges. This is a good picture just showing you the papillary muscles. It's showing you the chordae tendineae. We got the conus arteriosus, the pulmonary trunk. Good. So let's now look at the left side of the heart. So once the blood went to the lungs, it became oxygenated. Now it's going to return to the heart, but it's going to go to the left side of the heart. The chamber that it's going to go into is the left atrium, right? So that's going to receive the pulmonary veins. Again, if you remember, a vein carries blood back to the heart, but this time it's going to be oxygenated blood. So we have two pulmonary veins, the left and the right pulmonary veins, and they enter the left atrium. Okay, so here's your pulmonary veins coming from the left side. We don't see the pulmonary veins from the right side, but they're kind of coming in there also. So all four veins open up into here. Now the blood is in the left atrium. It's going to move through a valve that we mentioned before right here, known as the mitral valve or the bicuspid valve, right? One, two leaflets, and then the blood will go into the left ventricle. Same as the tricuspid valve, the mitral valve has the chordae tendineae, and they're attached to the papillary muscle. And again, that papillary muscle contracts a little bit to prevent the blood, to tighten up the chordae tendineae and prevent the valves from flipping the wrong way. Okay, so that's our left atrium. The left ventricle is similar to the right ventricle. However, it doesn't have that moderator band that I mentioned before. That was only on the right side. So you're going to see on the left ventricle the same as the right ventricle. All of these muscular ridges here, those are the trabeculae carne, but we don't see a moderator band. The blood in the left ventricle, when that left ventricle contracts, is going to push the blood up towards the aorta. So what we see is the mitral valve will close at this point as the blood is starting to go up, and it's going to go this way. We don't really see it that well. We just see a little part of it. Here's the aortic valve, just a little bit of it. That valve will open right here. This valve will open, and then the blood is able to pass into the aorta over here. All right, the blood's going to be able to pass into the aorta. Now, the part of the aorta that the blood is going into is known as the ascending aorta. We're going to see in a moment there's three parts to the aorta. This part that goes up is the ascending aorta. This part that swings around to the left is the arch of the aorta, and then the descending aorta is going to head down, right? We don't see it over here, but it's directing down behind the heart, and then we see it again over here. All of that is the descending aorta. The ascending aorta has this widened area, this kind of expanded area known as the aortic sinuses. We're going to talk more about them when we get into the physiology of the heart, because there's these receptors that monitor like blood pressure and things like that. They're in the aortic sinuses. We're going to see on the next lesson the coronary arteries come off of the aortic sinuses. So for today's lesson, just know that there are these expansions at the base of the ascending aorta, right? They're a little of a widening of the ascending aorta. All right, and then as I said before, the ascending aorta is going to become the aortic arch and then the descending aorta. All right, so we don't see it on this picture, those aortic sinuses. I'll show you on another picture in the next lesson. But this is all going to be the aorta. All right, so the concept is from the left ventricle, the blood is going to go up, not back this way. We don't want that. It's a one-way valve. Instead, the blood is going to go through the aortic valve into the ascending aorta and then the aortic arch. Okay, so that's our left ventricle. So let's compare the left ventricle to the right ventricle, just to kind of give you some similarities and differences. So compared to the left ventricle, the right ventricle holds and pumps the same amount of blood, right? So they have the same volume. But if you look at them structurally, the right ventricle is thinner than the left ventricle. Let's take a look. So take a look at the myocardium, right? The muscle layer of the right ventricle. See how thin it is? It's really not that thick. But look at the left ventricle. See how thick it is? One of the reasons for that is this. When the right ventricle contracts, it's going to push the blood into the pulmonary trunk and the pulmonary arteries, which is going to take the blood to the lungs. The lungs are right next to the heart. We don't need a lot of muscle to force that blood into those blood vessels. Just that they're not going that far, so the wall doesn't have to be that thick. But look at the left ventricle. And here the blood, when it gets pumped out, has to go into the aorta, and then that aorta is going to feed the rest of the body from our brain all the way down to our toes. So it's going to require a higher pressure and more force. So look at the ventricle, it's much, much thicker. So the right ventricle develops less pressure. Again, it doesn't have to push the blood as far. And if you looked at the shape, you would see that the right ventricle is pouch shaped and where the left ventricle is more round. So this is an interesting picture. They took the heart and they just kind of sliced it across this way, transverse. So here you can see the cavity of the right ventricle being kind of pouch-like, right, thin wall. And then here's your left ventricle. Again, thick wall, and then the lumen or the chamber itself is more round. Again, here's a superior view. It's showing the same thing. Again, pouch-like, round. And this is when the heart is not contracting. And then when the heart is contracting, you can see the chambers become much smaller, and that forces the blood out of the chambers. So just kind of finish up on this heart valve thing. We talked about it pretty much. This just kind of hopefully put everything together. Again, one of the main things you need to walk away with is that the heart valves prevent backflow, right? They prevent blood from flowing backwards. We had two sets of valves. The atrioventricular valves are the valves between the atria and the ventricles. If you remember, those were the tricuspid valve and the mitral valve. When the ventricles contract, the blood pressure closes the valve. And remember we said that the papillary muscle also contracts a little bit and tenses those heartstrings known as the chordae tendineae. And that's going to prevent the backflow of blood into the atria. I didn't write it down here. You don't have to write it down either. We'll talk about it in a subsequent lesson. When these AV valves close, that actually produces a sound in the chest. If you were to put your ear up against somebody's chest, or you grab the stethoscope, you're going to hear the heartbeat, right? You know, that lub dub, lub dub. That first heart sound, the lub, actually comes from the AV valves closing, right? So that's what's producing that noise. The semilunar valves, as we mentioned, were the pulmonary and the aortic valves. Their major job, guys, is to prevent backflow of blood from the great vessels into the ventricles. We don't want that to happen. And if you notice, when we did those valves, we didn't see any chordae tendineae. We didn't see any associated papillary muscles, right? There was no muscular support. That's only on the AV valves. Okay, so the last couple pictures kind of just go over some of the valves. This is a top view of the heart where we're in the atria. We're actually in the atria and we're looking down into the ventricles. So this is the anterior. This is the back of the heart. So that makes this the left side of the heart, and this side of the right of the heart, the right side of the heart. So that has to be the tricuspid valve. If you look, 1, 2, 3 cusps. Okay, and you can see here that is allowing blood to, when it's open, to flow down into the ventricles, right? So here the valve is open and the blood is flowing down. On this side we have 1, 2 cusps. It's on the left side, so this has to be the mitral valve. And again, it's open. We're looking down into the ventricle. So at this time, it's also allowing blood to fill the ventricle. When these two valves are open, the semilunar valves are closed. This front one is the pulmonary. The back one is the aortic semilunar valve. Okay, so you can see here's a real picture of the aortic valve. So this is just showing you now when the mitral valve is open, it's allowing the blood to flow down this way. So now when the ventricles contract, notice the blood is going to get pushed up. Our tricuspid valve is going to shut and our mitral valve is going to shut, so blood can't flow backwards into the atria. But now the pulmonary valve and the aortic valve are open to let the blood go into the great vessels so that they can go to, in this case, the lungs, in this case, into the systems. And this is just a picture now showing on the left side, the left ventricle contracting, pushing the blood up into the aorta. So the aortic valve is open in this case, but look at the mitral valve, it is closed. Okay, so that concludes all of the structures of the internal anatomy. Again, all the structures of the two atria, the two ventricles, the associated valves.